So when it comes to burns, right, you have to know two different concepts. The time frame as to when the burn occurred and what the possibility of damage and potential complications are. But then that takes a while, I'll explain that too. But you gotta know the rule of nines first. So the rule of nines means that we can divide the body into nine, more or less, 9 equal portions. And so you have your patient, you have your arm, you have your body, and then you have your legs, okay? And you have your inguinal area, right, the private area. So the rule of nines establishes that you can divide more or less the body into sums of 9. So the entire head for the adult is 9%, okay? The entire arm, each arm is 9%. Okay, so again, this one, also 9%. Now, in relationship to the arms, not to my illustration, but how much bigger, or which one's bigger, the arms or the legs? The legs, right? Roughly, how much? How many times more than the arms?
At least half.
At least half, it's gonna be twice as much. So I want you to associate it with that. So if the arms are 9 each, the legs are 18 each. Make sense? Now, the anterior torso, the whole thing from neck down to the pelvic area, the anterior is 18% also, and the posterior is also 18. So, on top of that, 1% for the inguinal area, okay? You need to memorize these because they're gonna tell you a question like, they're gonna give you a question like that, where they tell you the patient has burned the, and anytime you're anticipating to do a rule of nines assessment, you have to pretend that the patient's in the anatomical position, right? So you can divide the arm into the anterior, into the posterior, right? So if I divide it in half like that, the arm, into the anterior, to the posterior, what is the percentage of the entire anterior part of the arm?
4.5.
4.5, half of it. What if I tell you, oh, you have to know this word too. Circumferential. Circumferential means the entire circumference of something. So if you have a patient who has a circumferential burn of the entire lower arm, meaning the entire surface of the lower arm has been burned, what percentage is that?
4.5.
4.5 also. So I'm trying to give you guys different ways that they're going to be asking you this stuff, okay? So just know the anterior arm, all of it, 4.5. The entire circumferential of the lower arm, 4.5. And that same idea applies to the lower extremities. If you have the anterior surface of the leg that has been burned, one leg, that's 9%. If you have the circumferential lower half of the leg, that's also 9%. If the head's 9%, what's the percentage if you just burn the back of your head? 4.5. You guys see the trend here? It's the same concept. And if they burn the lower abdomen, that's 9%, because the entire anterior is 18 and the entire posterior is also 18. Does that make sense, ladies? Okay, that's important for you guys to establish. You should also know critical areas of burn. So you should report or be fast in your interventions when you have any issues in your hands, the soles of your feet, because we use those for practicality. And if you burn your hands and you wait too much time and you have permanent nerve damage, you won't be able to feel anything afterwards, and it's going to lead to permanent complications. You guys follow? So hands and feet are very important, and then any burn that's close to the face. So you could have a chest burn, a face burn, a head burn. All of that is very important because it means that the airway is going to be affected. And in the airway, the problem with smoke inhalation, which is what we're talking about here, smoke inhalation, is that when you do inhale smoke, your airway doesn't swell up right away. It can take several hours for it to swell up. So you have to consider that. You have to know that that's your priority, any burns around here, and you have to observe them for several hours afterwards because the airway, the mucous membrane is going to swell up and it's going to obstruct the airway. You have to look for indications also of smoke inhalation. There's something called soot. You guys familiar with soot? Soot is the charred mucus that's coming out that's black and tarry that lets you know, oh, this patient inhaled some smoke. Another important consideration is stridor. which is an adventitious breath sound, an abnormal breath sound when you go, that's an upper respiratory obstruction. That means that the airway is closing off. Does that make sense? One more thing. CO, which stands for carbon monoxide. Carbon monoxide is the gaseous poison that's in smoke whenever you inhale it. And the problem is that this can kill you. And it can do so because what it does is it mimics, it mimics your hemoglobin. What I mean by that is if you do an SpO2 saturation, okay, I'm sorry, not the hemoglobin, it mimics the SpO2 saturation. When you do an SpO2 saturation, it's supposed to be like 95 to 100, right? These patients that have carbon monoxide poisoning, it's gonna show 98%. It's gonna show 100% because it binds to that protein that transports oxygen, except it's poison. So any patient who has suspicion of having smoke inhalation, even if their SpO2 says it's a good value, you must do an ABG. You have to do further assessment because that it doesn't guarantee that that saturation is adequate, is accurate. Does that make sense? Okay. Now the next thing we have to talk about that's very important also is going to be your phases or your stages of burn. So there's rules, remember we keep talking about